just whatever happens.
I love Dr. Mercy. She changed my life. Her name fits her well. Mercy. Have mercy. Have mercy on me.
Dr. Mercy, good morning. Jeff in Las Vegas.
Good morning, Jeff. How are you doing?
I'm wonderful. Thank you for joining me today to talk about your new series on TLC.
Yes, it's so exciting. It premieres on Wednesday, 9 p.m. Eastern on TLC, and I'm excited for everyone to watch it. It was a lot of fun, lots of people that we helped, and yeah, I'm super excited for everyone to see what we've been working on.
Well, both your parents were nurses. Did that influence you to become a doctor?
I think so. I grew up kind of smelling like that or sterile, clean smell. And I actually loved just being in the hospital. They would take me with them. And I kind of didn't think of anything else. I just always thought, if I wanted to do anything, I wanted to be like my parents. And my parents always wanted me to do more than they did. So obviously it was becoming a doctor. I never had a plan B or C. It was always plan A, become a doctor.
And from Nigeria to Chicago, was that much of a culture shock for you at 10 years old?
Oh my goodness, yes. We came around like August, September, and I've never seen snow in my entire life. And I definitely was not prepared. It's very cold in Chicago. And when you grow up for 10 years where it's 80, 90, the first winter was definitely rough for me.
And every doctor must choose a specialty. How did you come to choose dermatology?
So I actually chose dermatology towards the end of my med school journey. I wanted to treat patients. I wanted to see what I was treating. I wanted that immediate satisfaction for patients. And I also wanted a field where I can do surgery. I can talk to my patients. I can do cosmetics. But I really love the surgical aspect because when patients come in with a big lump or a cyst, they get to leave without having the same thing that they came in with. So it's an immediate satisfaction for me and for my patients.
Now, should viewers be prepared to see things they've never seen before? Because when you think of dermatology, there's a lot of things that are quite shocking. So what are some of the treatments you encounter in your show?
Oh my goodness. It was so many big lumps and bumps. There's a particular guy that came in with a big lump that's probably the size of like a big bowling ball. And he's been carrying that around with him for like 10, 15 years. And I was like, oh my goodness, like, how do you sleep with this? I think the size and the magnitude of what people come in with is very shocking. But I mean, I've never even seen some of these things before. So it was a first for me. But luckily, with my experience, I was able to treat all of them.
That's what's really puzzling about the show is that when someone has an ailment like that for 10 or 15 years, what do you think is their reasoning for not seeing a doctor? I know you're there to relieve suffering, but don't you say to them, why didn't you come in sooner?
That's always a question that I ask all my patients, and most of them are very scared. You'll be very surprised how many patients have had bad experiences in doctors' offices. A lot of them have been told this is benign, it's not going to kill you. And a lot of them also have really lack of access to medical care. And that's usually the biggest reason why most patients just ignore it till it gets so big.
And was it difficult for you to get used to the cameras? Did the camera crew become a second family?
Oh yeah. Initially for the consult, it was very hard because the room is small and I have the patients and all these cameras, but usually when I'm doing the surgery, that's when I'm most relaxed. So actually, I didn't really notice the cameras there, but outside of when I wasn't doing the surgery, I did feel like it was kind of a little nerve-wracking to have the cameras there, but the surgical part of it, I didn't notice the cameras at all.
Well, Dr. Mercy, thank you for joining me today. Congratulations on your new series. And I just admire you so much for helping people who are suffering, and you bring so much relief to them. So thank you so much for joining me today, and good luck with the series.
Thank you so much, Jeff. Thank you, and hope you watch it.
Oh, I will. Don't worry. I love this stuff. Take care.
Thank you so much. Bye-bye.